A tendon is a structure in the body that attaches basically a muscle to bone. So whereas ligaments attach bone to bone, tendons kind of bridge the gap between the muscle belly itself to the bone, which ultimately is going to be the bridge that allows motion, that allows joints to move. The Achilles tendon is the big strong muscle or tendon that sits in the back part of the ankle joint. It's going to attach to the back part of your heel bone, and its main role is going to be for ankle down motion or pushing off with gait. So Achilles tendonitis, there's really two that you can kind of talk about. There's more of a mid-substance of tendonitis, which is going to be, the 4 to 6 centimeter area from the back of the heel where it connects. And the other one is going to be insertional Achilles tendonitis, and that's right where that Achilles connects to the back of the heel bone. Tendonitis, in its simplest definition, is inflammation of the tendons. I think a lot of times people will come in thinking that they have Achilles tendonitis when really it's been something that's been going on for 6 months, in which case there's thickening of the tendon, there's scar tissue that's built up. It's more of a tendinopathy at that point, so more of a long-standing issue, whereas some of the simplest anti-inflammatory medications may not address this issue as it's more of a chronic problem. The way Achilles tendonitis is often described, and again, it depends on which kind, but people may notice some thickening of the Achilles tendon in the back part. They describe it as maybe a burning pain or a stabbing pain in the back of the heel or around that Achilles tendon, and it's not all that different from plantar fasciitis, in that first step out of bed or first step after sitting for a while can be the most uncomfortable to like kind of get up and get around. Going up and down stairs, or you can imagine anything that's really tensioning the Achilles tendon is going to probably aggravate this. Oddly enough, that is doing that and stretching out that calf muscle is going to be kind of the cornerstone of early conservative treatment for that problem. So I think Achilles tendonitis, the cause is multifactorial. I don't think it's all that different than plantar fasciitis, because I think the underlying issue often is a tight calf muscle, but it's overuse. And I tell patients this is a living your life kind of disorder. This is a wear and tear kind of condition. I'll often describe it as kind of an arthritis of the tendon, because oftentimes when it progresses from tendonitis to tendinopathy, that truly is kind of more of a wear and tear of the tendon itself. So it is a combination of overuse, overactivity, tight calf muscle. Achilles tendonitis largely starts with conservative management. So the cornerstone is going to be eccentric calf stretching to really try to decrease the tension on that tendon or on the heel bone where it connects. Anti-inflammatories, if it's early enough in the process, sometimes putting people into a boot for a little while is what they need to kind of get things to calm down before they can get into some of those stretching exercises. And this can be either on their own as part of a physician-directed exercise program versus getting into physical therapy, where they have some other anti-inflammatory modalities that can kind of help and assist with this recovery process. But even just doing something like putting a gel heel cup in the shoe to lift the heel up a little bit to decrease some of the tension on that Achilles tendon, sometimes that's helpful in and of itself. The time to see somebody about Achilles tendonitis is basically when it starts to bother you more and more each day, affects you from doing things that you want to do or have to do or need to do. And something like simple stretches or appropriate shoe wear changes or activity modification or anti-inflammatories aren't cutting it anymore. And that's a time to go in and see if there's any other conservative options that are available, or if you need to consider a surgery for this, which is a last resort, but I think a good option for this problem should it ever get to that point.